How long should you have knee pain after having a meniscus surgery? Well, it depends on what type of meniscus surgery you had. There's three main types. The first type is a meniscectomy, where a chunk of the meniscus is taken out and removed. The second type is a meniscus repair, where a flap of the meniscus is sewn back to itself so that it can heal. And the third type is a meniscus transplant, where a piece of meniscus tissue is taken from elsewhere, usually another human, and put into your knee so that you can have brand new meniscus tissue from another person. And one more factor that could impact your healing and knee pain after surgery is how the surgery was done. The most common way it's done these days is through arthroscopic procedure. So that's where they take scopes, or they take little kind of probe looking tools that do the procedure. One's a camera usually, and they can cut things, they can sew things, they can do all kinds of different techniques inside your knee through the little tube. The other option is where they cut your knee wide open. That is not commonly done anymore. Now let's talk about meniscectomy recovery time. Now this is the most common surgery done, and it's the easiest for most surgeons because they don't have to reconnect anything. They just cut out the part that's hanging out, the flap, or remove anything else that needs to be removed. They clean up the joint and then sew you up where they had the little incisions for the arthroscopic procedure, and you're good to go. Now the downside for this surgery is that because the meniscus acts as a cushion between your thigh bone and your shin bone, if they take a piece out in this meniscectomy procedure, then you have less cushion, which leads to faster development of osteoarthritis. And they've shown this in medical research. Now it's quite common to take 3 to 4 weeks after surgery to get rid of the pain, as long as you're not re-aggravating it and causing more swelling. As long as you're doing everything right, you should be feeling like you're improving week to week during those 3 to 4 weeks. You still need time beyond that to fully heal and be able to get back to everything as you normally did before, but usually pain diminishes significantly within the first month. The second surgery is a meniscus repair. That's where they go in and they sew edges of the torn meniscus together. This is more complicated, and there's higher risk for re-injuring the meniscus after the surgery because you cannot move your knee all the way for at least a month, sometimes even 6 weeks, depending on what your surgeon recommends for you to do. So you'll be in a brace that locks you from going past 90 degrees, so you can't bend your knee all the way, and usually you have to remain in full extension or your knee straight so that you can allow that meniscus to heal. And once you reach a certain threshold, usually somewhere in the 4 to 6 week range, your surgeon will tell you, okay, you're clear to bend your knee more. You can begin to do more aggressive exercise as well. Usually the pain diminishes tremendously within that first month after the surgery, but once you're clear to do more motion in your knee, you might run into pain again because you have not moved your knee the way that you were before, and sometimes that's painful. The third surgery is that meniscus transplant surgery. So this is a lot like the repair in that it takes another 4 to 6 weeks of being in a brace where you're locked and you can't bend your knee, because they've inserted a chunk of meniscus, and usually they're drilling into the bone of your thigh bone or your shin bone so that you can keep that chunk of meniscus locked in place. So they don't want you to go through a lot of movement and free up the surgery. You're going to have a surgery all over again. Now the transplant is usually done in younger individuals that have no sign of arthritis. Otherwise they'd be recommending a knee replacement. So if you're 55 or younger, then there's a slight increased chance you'll get this. And the transplant is typically done after there's already been a meniscus surgery, usually a meniscectomy where they've taken a chunk out, so they need to add some more back in. That's why the transplant. Now because this is more involved, it's normal to have pain for up to 6 weeks after the surgery, and then once you're asked to move your knee more, it's probably going to hurt more again at that point. But you want to do the best you can to avoid doing anything that makes it hurt more, unless of course your surgeon tells you need to do it. Then of course you have to do it. Now what if you still have knee pain 3 months after your meniscus surgery? Well, I answer this question in full detail in tomorrow's video, so make sure you subscribe and turn on your notifications if you haven't already. I'll see you in the next video. Bye-bye.